Thank you very much for coming into the office this evening. It looks like I have you in, of course. It looks like I have you in for a head-to-toe assessment. More so just making sure that everything is okay. So I do have you as a new patient, so welcome to the clinic. Dr. Johnson did refer you as he is retiring, so I'm happy to take over his patients for him. Of course, wishing him a happy retirement, so we can go ahead and get started. I do just have a couple questions to ask you, of course, some preliminary information, and of course making sure that I am performing care on the correct patient. So if I could just have you confirm your name for me.
India.
India, very good. And then if you can just confirm the year of your date of birth.
1990.
1990, very good. All right, now obviously you're here for just a basic head to toe. Is there anything you're particularly concerned with today? Anything that maybe is abnormal or anything you've noticed?
No.
No, okay, so overall in pretty good health.
Yes.
That's good news. Can you tell me if you're in any pain today?
No pain.
No pain, good. Any recent injuries?
Nope.
Perfect, okay. Glad to hear that you are doing well. So just a quick couple of questions. Any recent changes to your medication?
No.
No. Are you taking any new supplements?
No.
Any dietary changes, dietary restrictions?
No.
All right. Any known medical allergies that we don't have listed?
No.
Okay. And I do see that you are allergic to latex.
Yes.
Perfect. Just making sure we have that listed correctly on file. All right, I think that's all of the preliminary information I need. I did have my nurse obtain your vital signs, and it looks like all of that was normal. Blood pressure was within normal limits, and you don't have a fever, so that's very good news. Okay. So we can go ahead and get started. I have everything ready here for our basic head-to-toe assessment. I'm just going to pop on a pair of gloves to start. All right, so let's go ahead and begin with your assessment. And I think I'm going to go ahead and start with just a basic visual inspection. So I typically like to just use my pen light to kind of have a look at your overall posture. Obviously now you're lying down, but I'm just going to have a look to see if there's any particular wasting of your posture from one side to the other. Essentially checking for any misalignment, as well as just having a look at your face and seeing if there's anything I see that is concerning, okay?
Okay.
All right. Just going to come a little closer here. My light is a little bright, so you're welcome to close your eyes if you prefer. So just going to start by having a look at your face, also visualizing your scalp. You have beautiful hair, so just looking for any abnormalities along the hairline there, which I'm not noting. Also going to have a look at the skin texture and overall complexion. Looking for any signs of abnormality here. Okay, so having a look at the nose. Lips appear very well hydrated. So having a peek at the neck as well as the chest, and your skin complexion is very even throughout, which is good news. So shoulder and neck alignment appear midline. I'm not noting any atrophy there. Okay, so having a look at the abdomen, I'm not noting any abnormal distension. I will do a brief abdominal assessment here shortly. And legs as well appear okay. And of course, I'll have a look at that as well. Okay. Just gonna have a little bit of a closer look here. So looking at your hair. Not noting any abnormalities there. Let me just come around here slightly. You ever have any issues with your scalp?
A little.
A little bit? Okay. And that as far as like dandruff, dryness?
Yes.
Okay. So So that's fairly common. I would guess that most of the population does have some issues with dandruff, so very easily accommodated with a simple dandruff shampoo. I typically recommend something like a Head and Shoulders. If you find that the issue is persisting, you can try the clinical strength Head and Shoulders. Essentially the same thing, just a little bit stronger. And then if you feel like that's still not working for you, or your symptoms are persisting, or you see like an excess flaking that's protruding onto the forehead, you can definitely come in, or I can get you referred to a dermatologist. They can have a look at that a little better. Okay. All right, so skin complexion itself is very healthy, not noting any excess dryness of the skin on your face. No active blemishes. Eyelashes and eyebrows are intact and hair growth appears normal. Okay, having a look at the neck, looking for any signs of swollen lymph nodes. Anything that could indicate a sign of infection, which I'm not noting here. Okay, so all of that looks very good. So let's go ahead and start with, take just a simple measurement of your head here. And essentially just measuring for circumference, so midpoint is at about 12 inches, which is good. And about 9 inches across the front, which is fine. Okay. Clavicle, about 10 and a quarter there. Okay. It's fairly symmetrical there, which is good news. Okay. So we're going to go ahead and have a look here, and I'm going to start with an inspection of your eyes. So I'm going to check for pupillary constriction and dilation. So essentially what that means is I'm going to be shining my pen light in your eyes, just looking to see if your pupils are able to react normally. So I'm looking for a specific consensual and direct response here, okay? So I'm going to be testing them both together and then separately. So just to start, if I can have you just kind of look straight ahead, the light is going to be very bright, okay? Very good. So direct response is intact. Now I just have an occluder here. I'm just going to place over one of your eyes. And that just allows me to test individually. And then consecutively. Very good. And then just a little swinging light test here, which just allows me to check once again. And that looks very good. Okay. You ever have any issues with your eyes as far as like excess tearing, excess dryness, drainage, redness, irritation? No. Okay. I see that you're wearing glasses. Are those prescribed by an optometrist?
Yes.
Okay. And are they up to date? Have you had an optometrist visit recently?
Yes, just this month.
Just, okay, so you're right on time. That's very good. So I'm just going to have a quick peek with my ophthalmoscope. So this device just allows me to have a quick peek inside your eye, mainly looking behind your eye to see if there's any abnormality there. So I'll have a quick peek at your optic disc and make sure I'm not seeing anything abnormal. Now, obviously, if you just saw your optometrist, there's probably nothing to worry about. All right, I'm just going to come a little closer here. If I could just have you look at me. Good. Just following the optic nerve. Just going to gently hold your eyelid here. Perfect. Okay. Very good. Okay. So optic disc is intact. Excuse me. I didn't notice any abnormalities with that. When you saw your optometrist, did your prescription change at all, or did it remain about the same?
It Remain the same.
Remain the same. Okay, that's good. All right. So let's go ahead and proceed. And since we're checking your eyes, we might as well complete our eye exam. So I have a couple things that I would like to test. Now you did just see your optometrist, so obviously I'm not particularly concerned. I'm going to go ahead and use this pocket chart here to just test your visual acuity. Now, okay, so you're able to see this here?
Yes.
Okay, if I can have you read this line here.
LT.
Good. And then this here.
OLCF.
Are you able to read the smallest line?
LTFPH.
Very good. And then if you can just tell me if 1 here is smaller or if 2 is smaller.
1 is smaller than
1
2.
is smaller. Very good. So vision is about 20/20, which is expected, so that's very good. So I do want to test you for color blindness. When you went to see your optometrist, did they test you for color deficiency at all?
No.
They did not. Okay. So I'm going to briefly test you for that. I just have a couple plates that I'll have you look at here, and then I also have a couple different things that I'll have you just describe the color for me if you can. Okay. So can you tell me if you see a number here?
8.
Good. In here?
5.
Very good. And this one is a little bit harder.
7. 16.
Hold it at this angle. Is that any better?
45.
45. Very good. I could see why you said 16. It does look like that. Now this last one is going to be a little more difficult here. Can you see these two?
35.
And
96.
very good. So in line with that test, I have a couple different colored pens, and I'd like you to just indicate what the color is to the best of your ability. You don't have to be super specific. All right, so this here,
Pink.
very good, and
Green.
good,
Purple.
perfect,
Blue.
good,
Red.
good,
Yellow.
and lastly,
Black.
perfect. I'm going to use this red one. And I'm just going to test your blind spot. So what I'm going to do is occlude one side, and I'm going to move this around in your periphery. Now, essentially, there should be certain areas where you're not able to see it, so I'd just like you to indicate that it either disappears or that you can no longer see it. Okay? So I'll have you keep your head midline here for me, and then try to keep your eyes just facing forward. Don't follow this with your eyes if you can, if that makes sense, okay? So if I cover this side, can you see that this is red?
Yes.
So just tell me when it disappears.
Disappeared.
Good. Can you see it now?
Yes.
Tell me when it disappears.
Disappears.
Good. Can you see it now?
Yes.
Perfect. So again, tell me when it disappears. You see it here?
Disappears.
Good. And here.
Disappears.
Good. We're going to do the same thing with the other eye. You see that this is red.
Mm-hmm.
Just tell me when it disappears.
Disappears.
And disappears.
Disappears.
Good. And 2 more. Disappears.
Disappears.
Good. Can you see it here?
Yep.
And disappears.
Disappears.
Very good. Okay. So your blind spot is reacting normally, and that's very good news. So you are not colorblind, and your periphery is working just fine. So that is especially important, for example, like when you're driving, so that you can see things that are not just directly in front of you. So that's very good. Just going to take a quick note here that your eye exam is well within normal limits, and you did visit your optometrist within the month, which is good news. Do Do you wear contact lenses or just glasses?
Just glasses.
Just glasses, okay. And do you wear those all the time?
Yes.
So full-time lenses. Visual acuity is 20/20 with glasses. Okay. And periphery is normal. All right. So we can go ahead and move on. And let's just work in order here. So I'm going to test your olfactory nerve. Now, essentially that just means I'm going to check your nose and see that everything looks okay. I'm also going to have a look at your sense of smell and see if you're able to perceive smells normally. And then I'll do a bit of an oral exam, okay? So this is an otoscope, and this is going to allow me to just have a brief look in your nose. So if I could just have you tilt your head back just slightly for me. Good. And then just relax. I'm just going to have a quick peek. So nares are pinkish in color, not noting any discoloration there. Mucosa is normal as well. No signs of occlusion. And I'm not noting any deviation in the septum. Do you ever have any issues with like seasonal allergies or stuffiness of the nose, anything like that?
Yes.
You do? Okay. So I'm going to do a test for your nasal patency. Essentially, that means I'm going to close off either sides of your nose. I'd like you to just take a breath in through your nose for me, okay?
Okay.
So go ahead and breathe in. A little stuffy there and here. A little less there. So you feel some stuffiness on that left side? Okay. Is that normal for you?
No.
No, it's not? Okay. I'm just going to check your sinuses. Do you have any pain in your sinus cavity here? Any
No.
pressure, tenderness? Have you been sick recently?
No.
Okay. You do sound just a touch stuffy, but it is that time of the year. Did you say you have seasonal allergies?
Yes.
Yeah, okay. And no pain or tenderness here along the maxilla?
No.
Okay. All right, so let's go ahead and test and see if that stuffiness is affecting your olfactory nerve or your ability to smell. So I have a couple different things here. Now they are, I would say, average, very common sense that you should be able to identify. So if I can have you keep your eyes closed for me, I'm going to bring something up in front of your nose and I'd like you to smell and tell me if you can tell what it is. For the first one, we're going to do it with both nares open. Okay. So go ahead and take a smell for me. Can you tell what that is?
Lemon.
Lemon, very good. Now for the second one, I am going to close off one side. And again, I'd like you to try to guess what it is. So we'll start with this side. Go ahead and smell for me.
Lemon.
Lemon again. Let's try the other side. Okay.
Lemon.
Okay. So one of them was lemon. The other two were actually orange and tea tree.
Okay.
Okay.
I was smelling orange.
Okay. So that first one was lemon. The second one was orange.
Okay. That's what I figured.
Okay. That's okay. So I'm going to go ahead and test kind of something similar. Let me just have a quick peek first. Any issues with your mouth or your teeth, your tongue?
Oh, please.
Do you ever have any issues with your mouth or your teeth or your tongue?
Oh, no.
Okay. Have you been to the dentist recently or do you visit a dentist regularly?
I have been in the past 6 months.
Okay, so you're still on track with your yearly appointment, so that's
Yes.
fine. Any recent cavities or like tooth root canals, anything like that?
No.
Okay. All right, so if I could just have you open for me. Very good. So Oral health appears intact. Your teeth are very clean. Tongue is very pink. If I could have you lift your tongue to the roof of your mouth. Good, and then stick your tongue out and say, ah. Very good. So uvula is midline. Teeth look great. I'm not noting any cavities. So I do have a couple different things that I will test for your sense of taste. Now they are very common and fairly easy to detect, so you should be able to tell me what it is. Just going to be a very small drop of liquid here, okay? So I'm just going to draw this up in my syringe. And just a small little taste here if you can tell me what this is. Okay. Sweet, good. That is sugar water. Okay, and this next one.
Salty.
Salt water. I do apologize. I know that's a little bit unpleasant, but you did very well there. So let's go ahead and continue. And I think the next thing I want to do is go ahead and test your ears. So I'm just going to have a look in your ears. Do you ever have any issues with your hearing or with your ears? No, like abnormal discharge, ringing of the ears, nothing like that?
No.
Okay. Just going to have a peek with my otoscope here, and I'll go ahead and start on this side. Are you currently having any pain or tenderness of the ear?
No.
No. Okay. So just going to have a look. And not noting any abnormalities thus far. So the external ear does appear fine. Slightly dry, but everything looks okay. No abnormal discoloration. And if I have a look internally, everything looks okay. So the ear canal is clear and free of debris. No abnormally discolored cerumen. And tympanic membrane is pearly gray. Very good. Okay. So I'm going to have a look at the other side, and I'll just stand for just a second. Okay, and again, the external ear appears normal, and the ear canal is clear. Okay, very good. Good. Ever have any issues with your hearing? Difficulty hearing?
No.
No. Okay. So let's go ahead and do a hearing test. And I have a couple different things that I will test. So why don't we start with just the basics here. So I'm going to make a little sound with my hands. If you could indicate when you hear it just by saying yes, okay? So close your eyes for me.
Yes. 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 Yes.
Very good. So I'm going to make another sound. This time, if you could indicate which side you hear it on. Okay? So you can either say left or right or front or above, whichever.
Right. Above. Left. Below.
Very good.
Right. 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 Left. Right. Above. Right.
Good. And then I'm going to test one more thing for your hearing. This time it's going to be a very quiet puff of air. So I'm going to test to see how far your hearing goes. So I'd like you to tell me when you hear the sound stop, okay? So you should be able to hear it here. Tell me when it stops.
Stop.
Good.
Stop.
Very good.
Stop.
Very good. And lastly,
Stop.
good job. Okay, I tried to trick you there, but you got me. Very good. All right, so I'm just going to catch up on my notes here quickly. So your ear, nose, and throat exam is all intact, which is great news. So there are no abnormalities with your hearing. Ears are clear. You did have a little bit of dry skin externally, so just on the external portion of the ear here, just slightly dry, but again, that is normal. And if you're an individual who's prone to dry skin, especially like if your scalp is dry or your face is dry, then it's likely that your ears will also be dry, so that's okay. I will say that your nasal patency was maybe slightly abnormal. It does appear as if you've been affected by seasonal allergies. So your left nair was just slightly more occluded than I would like to see. So slightly affecting your sense of smell, but again, I don't think it's anything neurological. I think it just has to do with the fact that your nair and your mucous membrane in your nose are just slightly inflamed from allergies, so that's okay. Do you ever take anything for your allergies? Any like over-the-counter medication?
Occasionally, sometimes.
Occasionally, okay. So if you ever notice that you're really having difficulty with that, then I can refer you to an otolaryngologist or an ENT doctor, and essentially they'll just have a little bit of a further inspection, look for anything like nasal polyps, that kind of thing, okay?
Okay.
All right. And your oral exam looks great. So sense of taste is intact. Your teeth appear very healthy, very well taken care of. And you are seeing a dentist regularly, so that is great. All right, so we can go ahead and move on now. I'm going to, let's see, I'm going to finish up with the face exam by doing a bit of a palpatory assessment. So I'm going to come up a little closer to your face here, and I'm just going to feel around a little bit for some different areas. Feel around for the bone structure, feeling for any swelling or abnormalities, and then I will feel specifically around your lymph nodes. Just make sure that there's nothing going on there, nothing that can indicate a risk of infection. Okay, so you're going to feel my hand here. I'm just going to start by feeling around the scalp. So I'm just going to feel for any lumps or bumps. So far not noting anything abnormal. Cranium is smooth. No signs of abnormal distension. That's very good. Just going to feel along the forehead, feeling that sinus cavity here, feeling for any sinus pressure, which is not noted. Okay, so I feel along your jawline here, feeling along the mandible and maxillary areas. Okay. Very good. No signs of misalignment here. I'm not suspecting that you suffer from any TMJ. No clicking or popping of your jaw ever. Good. So I'm just going to feel along your lymph nodes. So you have lymph nodes that run here along your chin. Just feeling for any swelling there. Good, so nothing abnormal noted here. Again, I'm going to feel along the clavicle, feeling for any abnormality here. So we have clavicular nodes that run along the chest wall. Not feeling anything here. Maybe swallow for me. Very good. Okay. So I'm going to continue working down. I'm going to have a look at your hands. Your beautiful nails.
Okay.
Skin is well moisturized. Here, having a look at the joints. Good. Look at the palm, looking for any signs of abnormal discoloration, any palmar erythema or redness of the palms. And I am going to go ahead and check your capillary refill, so just testing how quickly blood returns to the surface of the skin. And I am getting a +2 response here, which is very good. Okay, so if I can just have a look at your other hand. Good. So again, skin is well moisturized. Not noting any rigidity of the joints. And capillary refill does appear intact. Okay. All right, you can go ahead and relax. So I'm just going to have a look at you overall here and just look at the midsection, see if I'm noting any abnormalities. So far, everything looks okay. Do you ever have any issues with your abdominal cavity? So, indigestion, abnormal bowel movements, diarrhea, that kind of thing?
Oh, yes, sometimes.
Sometimes? Okay. Is that secondary to like eating anything that maybe is intolerable for you, or?
Yes.
Yeah, okay. So that can be normal. Some people have sensitivities to certain things. Obviously, a common one is lactose intolerance, but some people also have sensitivity to acids like lemon, oranges, limes, that kind of thing. Some people also have issues with spicy, so salsa, even like tomato juice, that kind of thing. So just be wary of that if you notice a pattern of things that you're eating that upset your stomach. Could just be that those things maybe are not super tolerable for your gut health. Okay?
Okay.
Now, if you notice any persistent diarrhea or anything that's not kind of mitigating itself within a couple of days and you haven't eaten anything out of range of your normal diet, then you might want to call in and make an appointment. We can get you in to see a gastro doctor. Okay?
Okay.
So I'm going to have a listen with my stethoscope, and I'll begin by listening to your heart. So you're going to feel something cold on your chest. Just breathe normally for me. Just listening for any abnormalities of your cardiac health, for any signs of arrhythmia, abnormal rate and rhythm, which is not noted. Listening for any palpitations. Rate and rhythm does appear normal, not noting any audible signs of tachycardia or bradycardia, which is a good sign. Just going to listen directly at the sternum here. Very good. So I'm just going to listen to your abdomen. So listening for any abnormalities here. Any signs of abnormal digestion. Any occlusions of the digestive tract or in your colon. So all of that does sound okay. I do hear some activity. It sounds like you are digesting maybe your breakfast. That sounds okay. if I can have you breathe and hold your breath for me. Good. Go ahead and breathe out. Very good. Okay. So I'm just going to listen directly over the umbilicus here. Very good. So I'm not hearing any occlusions there. That sounds very good. And I'm just going to listen to your pelvic pulse here, which I'm not noting anything abnormal there. Good. Okay. Very good. So your stethoscope assessment, was very normal, not noting anything concerning there, so that's good. All right, so I'm going to go ahead and proceed with a bit of an abdominal assessment. Now, are you currently experiencing any discomfort in your abdomen?
No.
No. Okay. So I'm just going to be feeling around with my fingers. I'm going to start with some gentle palpations. So just going to feel around here, looking for any signs of abnormal distension or any hardening of the abdomen. So essentially just using my fingers to feel for your anatomy, feeling for your rib cage, noting any abnormalities in your breathing. Palpating over the midsection, I don't notice anything abnormal there. Bit of a deeper palpation of the lower abdomen. Feeling for your organs. Good. So I'm just going to assess your breathing for a second. So I have just a measuring tool here, and as you breathe, I'm just going to measure the movement of your abdominal cavity with the chest rise and fall, checking for symmetry here. Good. All of that looks okay. Also going to measure the top of the chest wall in comparison to the pelvic bone there, which is midline, and then of course measuring from right about the umbilicus to the top of the sternum there, which is also very good. Okay. I'm going to do some percussion along the abdomen. Just listening for any abnormalities here. Of course, let me know if any of this is painful or uncomfortable. Just listening for any audible differences here along these bonier prominences. So far not noting any abnormalities there, which of course is great news. Okay. And then just going to do a quick check for density here. So just going to use this tool to gently compress specific areas of the abdominal cavity, and just looking for any signs of abnormality here. It specifically allows me to check for any signs of abnormal abdominal distension, which is not noted. Okay. So all of that does look normal, which is very good news. Okay. Taking a look at the pelvic alignment, looking for any abnormalities there, which I'm not noting. All right, so I'm going to do just some palpations here, just feel around different areas, looking for any signs of abnormality in the extremities, so just feeling along your arms. Nothing here feels particularly abnormal. Okay. Of course, just gonna have a look at the other side. That does look okay. And while I'm here, I'm just gonna do deeper palpation here. Okay, just going to come down by your feet. Just, of course, having a look at the legs, the alignment of the lower extremities, placement of the pelvic bone in relation to the knees and ankles. So looking for any abnormality with the joints. Palpating along the lower extremity as well. So I'm just going to feel around your legs. Feeling for anything particularly abnormal here, which is not noted at this time. Feeling for any rigidity here. Good, and then having a look at the feet. Feeling for temperature differences, and your feet do feel slightly cold. So I'm just going to check your ankle mobility. Just going to have a peek at your heels. Heels are smooth. Checking your pedal pulse. Very good. Check the other side as well. Good, so heels are smooth. Pedal pulses are slightly more faint, but I do feel them. They are equal, so that's good. Just having a brief look at the toes. You have beautiful toes, very well manicured. Having a peek in between the toes, I'm not noting any abnormalities there. So that's very good. Same thing on this side. Not noting any misalignment with the joint. Arches do appear well intact, not noting any signs of a fallen arch or any hyperextension there. Now your feet are just a little bit cold. Okay, so I'm just going to quickly do a test for your neurological response. This is called the Babinski test. Essentially just going to test for reactivity in your brain. So it might be slightly ticklish here. Very good. Some normal movement of the toes. And again, very good. So go ahead and put your socks back on. So the last thing I'm going to do for your head-to-toe assessment is just a very brief test of your neurological responses. So I have a couple tools that I want to test just to see that your sensation is intact. Now, I'm not suspecting that it isn't. There's no reason for me to believe that you're not able to feel things adequately, of course. I would like you to just indicate, if possible, whether or not you feel something. I have a couple very distinct sensations, and this first one is going to start off very soft, kind of light and fluffy. So this here is a soft sensation, and I'm just going to test your ability for sensory perception. So this here should feel very soft. Good. And this should feel soft. Same thing along the chest wall, should feel soft. And along the hands, of course, should feel the same. So I'm going to alternate here, and this is going to be our sharp versus our dull sensation. So I'm going to start at the scalp here. So, of course, this is soft, very good. And sharp, very good. Soft. That was sharp, good. Soft. Sharp. 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 Soft. Very good. And let's see. So I'm going to go in with a tool that is very distinctly sharp. Now this isn't going to pierce the skin, of course, but I would like to just test your pain response. So I have this wheel here that I'm just going to move along certain areas, and essentially I'd just like you to let me know if you feel it and if at any point it feels differently than other areas. So all along your scalp here, that should feel equally as sharp. Here, here, and here. Good. And then along the hairline, you should feel sharp, but it should feel the same. Good. Same as on both sides of the forehead. And both sides of the face. All underneath the neckline should feel equally as sharp. Good. Along the chest wall, again very sharp. Good. And then lastly, does that sharpness feel any different than the sharpness here? Good. Okay. All right, so I have quite a few notes to catch up on here. Let's see. So your abdominal assessment was normal, so I did not feel any signs of abnormal abdominal distension or swelling, no edema of the abdominal organs. Your stethoscope auscultations were also normal, so your cardiac exam was intact. I didn't notice any signs of arrhythmia or abnormal cardiac health. Your rate and rhythm is within normal limits, which of course is what we would like to see for someone your age. I did hear some digestion happening, but of course that is normal. And your lower extremity examination was normal. I will say that your feet did feel slightly normal than usual. It is getting colder, but you are wearing socks and the heat is on, so it should not be that your toes are quite that cold. So that is just slightly concerning. So that's something that I would like you to keep an eye on. So for example, if you feel that your toes are purpling or turning blue, then obviously that's something very concerning that we would be wanting to further investigate. So any issues with the feet can be very concerning because then we're looking at a risk for diabetic infection. So I would like you to let me know, of course, if you continue to notice that coldness in your feet, specifically as we move out of winter and into the warmer months. If your feet are still feeling abnormally cold, that's something we would want to look into. Okay? So then I can refer you to an endocrinologist, but for now I would say we are okay. Babinski reflex was intact. As I moved into your neurological testing and testing your sensory perception, all of that was intact. So you are able to feel the difference between certain stimuli, your sharp or dull sensation is intact, and of course your pain response was perfectly normal. So that is all very good news. Okay. All right, Miss India, well, it was very nice to meet you. I thank you for coming in today. Obviously, I'm grateful for Dr. Johnson for transferring his patients over to me. I appreciate your time, and of course, if you have any questions or any concerns should arise, you are welcome to call the office and we can get you in for a follow-up, okay?
Thanks so much.
All right, thank you so much. I hope you get home safely.
Thank you.